Hello, I'm Tony DeMaria, the editor of JACC, and we're here with another session of the Genuine article. And at the moment, I have the opportunity to talk to Dr. Poldermans. And Dr. Poldermans is professor of medicine at Erasmus University in Rotterdam, and he's really one of the acknowledged experts on the preoperative, perioperative care of patients, particularly those with cardiovascular disease. And with respect to JACC, the major corresponding author of a recent study examining the prognostic significance of patients with peripheral arterial disease, comparing it to patients with coronary disease. So Dr. Poldermans, if you could just tell us what exactly was the nature of the study you performed.
Now, we evaluated the long-term outcome of patients referred for vascular surgery to our center, and we looked for perioperative outcome, but most importantly also for long-term outcome. And as it showed that patients with peripheral arterial disease have a very poor outcome compared to a matched population for all the clinical risk factors of patients with coronary artery disease. The odds of late mortality is 2.5 times as high as the matched coronary artery disease population.
Okay, well, let me ask you about that. It seems kind of intuitive that if you have two diseases, coronary and peripheral, you're probably going to do worse than if you only have one disease, which is coronary. What is surprising about your findings?
Indeed, most of the patients with peripheral arterial disease have coronary artery disease, although not recognized. But patients who present only with coronary artery disease without symptoms of peripheral arterial disease have an improved prognosis compared to peripheral arterial disease. And it may be two ways to explain it. First of all, it's a different disease. So if you have peripheral arterial disease, you have a more advanced atherosclerosis. Secondly, patients with peripheral arterial disease are undertreated for their risk factors. So there are two ways to explain their poor prognosis.
I see. So in other words, you examined quite a large number, several thousand patients, and the patients with peripheral arterial disease, I take from your comments, really did not have symptomatic coronary disease, at least not much prevalence.
They have coronary artery disease, but most of the patients, for instance, have an inability to perform really physical exercise. So their statement is, I used to have angina pectoris, but since I have a reduced exercise capacity, I've cured of the angina pectoris, which of course is not true, but it's hidden. So those patients have coronary artery disease, but mostly asymptomatic.
Now, in terms of the type of peripheral arterial disease, was it important whether it was limited to, say, the carotid or iliofemoral bed or even the central aortic bed?
Now, that was one of the most striking findings. For instance, if patients were referred to our hospital for carotid surgery, their postoperative outcome, 30 days, was relatively good, 1.6% mortality. However, if they were referred for AAA surgery, the outcome was much worse. But once they have survived surgery, it didn't matter. So patients with carotid, AAA, or peripheral bypass surgery did just as worse. So it may be that it's a generalized disease, and if you present, for instance, with a carotid, the long-term outcome is just as bad as patients with AAA. Again, emphasizing the fact that you should aggressively look for those risk factors and treat them to make an improved prognosis of your patients.
Right. Why do you think that physicians in general have treated patients with peripheral arterial disease less aggressively?
Now, for some reason, it seems those patients have a benign prognosis. So they may have, for instance, claudication. They think, okay, that's all claudication. But they are not aware of the fact that it's a generalized disease. So, as we always say, it doesn't stop at the heart. The heart is included in patients with peripheral arterial disease.
Now, in terms of your study, I guess the exact cause of death was often cerebrovascular. Is that correct?
Exactly, that's correct.
So that the implication here might be that in a patient with, let's say, lower extremity arterial disease, you need to be particularly cognizant of the cerebrovasculature.
Exactly. So what we would recommend is to look for patients with peripheral arterial disease, so include an ankle brachial index. For instance, patients who have a reduced peripheral circulation have a very high incidence of a AAA. It goes up in the 20%. So it's mandatory if you see a patient with atherosclerosis to look for the ankle brachial index to see if there's a reduced peripheral circulation, try to look for other affected vessels, and then aim at optimal medical therapy to improve their outcome.
Well, very interesting. Certainly I learned something from this manuscript. A large number of patients that Dr. Polderman studied and followed, and in fact showed that the prognosis for patients with peripheral arterial disease is quite severe and certainly in line with those patients who have coronary artery disease, and therefore these patients really are deserving of very aggressive evaluation and risk factor modification. I hope you'll enjoy the paper when you read it, and look forward to meeting with you again on our next issue of the Genuine article.